All right, today I'm going to talk to you about IT band syndrome. It's a painful issue that a lot of runners deal with, especially after they've done maybe a long run going downhill. But what it is it generally is pain right here on the outside of your knee. You have a thick band of tissue that comes right down the side of your leg and then comes down in here and attaches. Most of the time, people will try and roll that tissue out with a foam roller. That's just going to be painful and probably not going to help your pain in your knee much. What you want to do is really focus on maybe working on these outer muscles in the leg up here, and then also on the hips. What I like to do, and most runners have one of these massage guns now, but I take this and I come down on this muscle and just kind of massage that a little bit, try and loosen it up, bring a little bit of blood flow to it, and then I'm going to have her resist here, hold that up, and as she's holding that and contracting that muscle, I'm going to work on that a little bit. Okay, now relax and hold that a little bit against resistance, and as she lets me slowly lower that down against resistance, I continue to work on that muscle. Okay, and we're going to do that, and if there's a tender spot, we're going to kind of work on that tender spot and see if we can't get that tender spot to release and feel better. And we're also going to do that, and I'm going to have you roll on your side facing the wall. And we're also going to come in here on these glute muscles, which play into this. These glute muscles come in and tie to that big, thick tissue that runs down the side of the leg, and that can pull on that and cause some of those knee pain. And so what I'm going to do here on this one is just come back here, have them bring up their hips like this, hold that up. I'm going to kind of work on that, push up, hold that up. And as they're holding up, I'm going to work on that muscle also. So if you have somebody that can help you with this, that's great. It makes it a little bit easier. And again, you're probably going to find some tight spots, tender spots in there that are going to be sore, and you're going to want to work those out. Once you've kind of got those tight, sore spots worked out, then you go to strengthening and doing some exercises with that. All right, now I'm going to show you some exercises. We're mainly going to be focusing on these glutes to get these glutes stronger, which tie into this band, this IT band going down the side of your leg. And they're going to help take some of that pressure off where you're feeling that pain. Okay. First one I like to have people do is either just a general step up and down, and just come up and down with that. Or I like to have also people focus on just the eccentric aspect of it, come down and touch, and slowly lower down and up. Again, you're going to want to watch that knee. Make sure that knee is just coming straight over your toes and it's not dropping in as you do this, okay? And make sure you're activating that glute as you do it. Slowly lower down and up, okay? That's one exercise that has been shown in the research to really get those glutes active and strengthen those glutes up. Some other exercises, you're just going to come down on the floor. Your bottom leg, you can have bent or straight out. What you're going to do is you're going to start with your foot turned in and just lift that leg up and down. And you're going to go slowly with those, and you should start to feel that burn in those glute muscles. And then you can turn your foot straight and do the same thing, up and down, and then turn it up and work it that way. You can also do some circles with that, and you should start feeling your glutes burning pretty good after you're doing all these different exercises. And that's going to help you get those glutes stronger and should help you start to overcome your IT band syndrome. And it's going to take several weeks of doing those on a regular basis to get you back to feeling good.